Hi, everyone. Welcome to my presentation titled Women's Invisible Health Risk, the Role of Bias in Diagnosis and Treatment of Major Conditions. My goal with this presentation is to give you an example of how to do this presentation, which is a review of the research process for annotated bibliographies, which you have completed, but I want you to have an example. So there were a couple of events that happened recently around the 2020s that brought a lot of national attention to the issue of women's treatment within the healthcare industry, particularly Black women. That also interested me since they surrounded childbirth, and I'd recently had my first daughter in 2019. Also, an important theme of some of these events were that they involved Black women in similar situations. In a few instances, the outcomes could not be written off as due to lack of care on the patient's part because the patients were literally Olympic athletes who dedicated their lives to training and caring for their bodies. The issues should have been foreseen and death and serious injury within our healthcare system preventable. Here's one of their stories. Allison Felix, Olympic athlete, was in the third trimester of her pregnancy. A test revealed she had preeclampsia, a dangerous high blood pressure condition in pregnancy, at 32 weeks, which is 2 months early of delivery. Her doctor sent her to the hospital and she eventually had a C-section to deliver her daughter early, who had to spend a month in a neonatal intensive care unit. Proper diagnosis and timely action resulted in both mother and baby being saved. Unfortunately, not all of the women were fortunate to come out of the situations whole and healing. One young mother, not a public figure, died from complications after childbirth, and it's important to note these complications can last for up to a year after birth. It's also important to note that she had mentioned her symptoms to multiple providers. What is troubling and frightening is that statistics support the finding that Black women are 3 times more at risk as compared to other mothers for death in pregnancy. And this is true despite the fact that 80% of pregnancy-related deaths are preventable. Stories like these give rise to the question, what is going on? Why are women, particularly Black women, at a greater risk for complications from routine health conditions? My research question started fairly broad, although my interest was sparked by a very specific situation, which is mortality among Black women surrounding childbirth. I wanted to know in general, are women at greater risk of poor outcomes when undergoing routine care within the U.S. healthcare system? I know pregnancy and childbirth are risky events, but I was curious also about general health concerns and conditions. So my research question raises that broad concern. I understood that my research question would most likely need to be narrowed, and I was counting on my research to direct my thoughts on this topic. Here were my suspicions. Women are more at risk of injury and death as revealed by the stories that prompted my research question, and that the disparity seen in other areas of life, including the workforce, would most likely be replicated in the healthcare system. I also assumed that women would differ in the types of diseases that they suffer from, which I was proven wrong, and I was proven correct that women's symptoms may differ from men. Okay, so let's see what the research uncovered. So before I talk about the conclusions of my research, I'll explain the process I followed. I decided to use Opposing Viewpoints database, since this database has a section called Viewpoints that provides understandable current sources that would most closely fit my topic. At least this is my assumption. When I searched the terms women's health, I mostly received sources addressing reproductive health. I wasn't wanting to go in that direction since reproductive health has an element of choice. I wanted to study life-affecting chronic diseases that put women at risk and that were more unpredictable, or unknown, I should say. So I changed my search terms to women's heart disease, since I had a suspicion that heart disease has a high mortality for both men and women, which I was correct. Heart disease is the #1 killer of women, above domestic violence, above diabetes, above cancer. The only downside with these search terms was that they were very narrow, and I didn't get any peer-reviewed sources. I got audio news articles and 5 magazine results. I thought this was okay since it would give me a start on understanding the topic. So already my research question was narrowed from general healthcare treatment to treatment and diagnosis of chronic diseases, namely heart disease. Reflecting on the research process. The research process was mostly smooth. I liked the relevance of the results that were returned with my keyword search. I did think I needed a broader list of results to sustain an annotated bibliography of 7 sources. Also, I didn't get any peer-reviewed articles returned on the first search. I had to adjust my search to, quote, Heart Disease US and, quote, Heart Disease America to get results from academic journals. And these mostly touched on heart disease, but in relation to other factors, such as cell phone towers and income. I would have to read through and really spend a lot of time trying to find a connection with these sources and ultimately rejecting many of them. Okay, so it gave me the idea that maybe this topic is not well studied outside of popular media, which was concerning. However, based on the audio results and some other results in my original search, I knew doctors were talking about the issue. The search was just challenging. I'm happy with the results I got with my, quote, heart disease women search term, which is a slight variation on what I used before, women's heart disease. Removing the possessive case and placing heart at the beginning of the phrase resulted in more sources from academic journals. I still had to skim these very carefully since academic journals report on research that is very narrow and specific. So it was very unlikely that all 3 of my concerns, bias, women, and heart disease, would be reviewed in full and thoroughly by many of the sources, which is typical, okay? Many of the sources still had to do with pregnancy, childbirth, reproductive issues, etc. Okay? All right, so on this slide, I'd like to discuss what I actually learned from the sources I used. And most of the sources I used came from that first search, which resulted in the less formal studies, but they gave me a clear understanding, and I saw some common patterns in the research, not in the research, I shouldn't say that, in the popular understanding of heart disease and how women are affected, the basic statistics, okay? So the consistency in the message is a cause for alarm and good reason to educate the public. There is a big disparity in how women are treated within the healthcare system based on bias, and this results in a much greater risk to their health, especially with chronic conditions which are fatal, such as heart disease, okay? The risk is even greater for Black women. So what is at the root of the disparity? I understand it to be bias in how women are perceived and treated and how heart disease itself is understood. Okay, so we have a picture of women and we have a picture of heart disease, and both of those have a lot of bias in there. So here's what I learned. 1, heart disease is an umbrella term that covers a variety of long-term and unpredictable conditions that require monitoring and prompt treatment. Coronary artery disease is the most common form of heart disease and the primary cause of death for women with heart disease. And this is defined as a buildup of plaque in the walls of the arteries that can block the blood flow to the heart, which would result in a heart attack. 2, heart disease most likely exists long before symptoms are apparent, but a major symptom of advanced heart disease, which is a heart attack, is shared by men and women, which is pressure or tightening of the chest in 90% of the instances. Number 3, secondary symptoms of heart attack differ for women, and this is where the bias may come in. According to Dr. Mertz, who presented research on how plaques are distributed differently in women's arteries, quote, 2/3 of women will have atypical symptoms such as severe fatigue, isolated shortness of breath, or even stomach upset, end quote. So you have the classic image of a man clutching his chest while having a heart attack that does not fit women's experiences. So the misunderstanding of how heart attacks present in patients is influenced by bias of the presentation in men, okay? So women may suffer heart attacks that, quote, come and go through plaque erosion rather than plaque explosion. Okay, so the bias exists in how providers anticipate heart disease and heart attacks to show itself. Okay, 4. Oops, sorry. 4. Common tests may not detect heart disease properly in women. As stated above, plaques are distributed differently in women, so they may not be detected as efficiently by current tests. 5. Women are less likely to receive proper treatment for a heart attack, which is catheterization to restore blood flow to the heart and clot buster medication. 6. Women have additional risk factors for heart disease, including pregnancy conditions like preeclampsia and preterm delivery. It's unclear whether this information makes a difference in how providers treat and diagnose women, since most medical care in the U.S. system is symptom-based, okay? Women would have to raise these concerns themselves. A new research question is needed to narrow the scope of my research and accurately reflect the results I've received. What role does bias play in mortality of women suffering from heart disease? And by role, I mean the failure to detect and treat symptoms of heart disease, okay? Finally, what conclusions can we draw from the research? It's important to teach women to speak up and to be aware of biases in how a condition such as a heart attack may present itself, and how heart attacks are understood by medical providers. These ideas are based on a single image, and that is associated with men's experience. Since heart disease is chronic, emphasis should be placed on detecting and treating it early. Providers must understand that women may have differing symptoms, and heart disease may not be evident in traditional tests. These reasons make it even more important not to pass off women's symptoms as a form of anxiety or psychological condition. That's very important, to take women seriously at their word, okay? The idea is to erase that prejudice of assuming that symptoms are attributable to something else, right? And that treat symptoms as indications of the actual physical disease. New tests and diagnostic strategies are needed, as well as prompt treatment, especially considering additional risk factors women possess, such as preterm delivery, okay, and preeclampsia. So those are issues associated with giving birth. Providers must be educated on the intersection of women's risk factors with the potential for heart disease. Responding to so-called typical symptoms is not an effective treatment plan. Women must know this is the mindset providers have when seeking treatment, so they may advocate for themselves. Unfortunately, a lot of times women need advocates. They need to surround themselves with others who can add weight to their feedback that they're giving providers. Until the mindset is changed and women are taken seriously, they have to use whatever methods would give them the attention they need. So this is a very high stakes issue. There's much more research that needs to be done, but women need to equip themselves and educate themselves on their own health, their own bodies, to effectively communicate that to providers, and to be aware that the bias exists and they may not be taken seriously, so they have to know that going into a medical situation. I'm not sure why my slide ended. Maybe I need to end the presentation here. I just wanted to give you an example of what I was looking for, and hopefully this helps you as you prepare your presentation. Thank you very much.